Assembly Bill 2161 amends current law, PL 2009, Chapter 130, to revise the state designation of Ovarian Cancer Awareness Month from February to September of each year in order to conform with the nationwide observance, which is in September.
We do have some family members, and they were in my district prior to the realignment. But we're always really proud of Pine Hill and the town that it represents and the great work that they do. We have Sean Rupp who's going to speak today, but Sean is also joined by Councilwoman Ruth McCullen and Sean's dad. So if you all want to come up, or if just Sean wants to come up.
Good morning, Assemblywoman Lampett, Assemblyman Fuentes, and Assembly members of the Women and Children Committee. Thank you for the opportunity to testify today in favor of Assembly Bill number 2161. I greet you with some devastating facts. More than 22,000 women will be newly diagnosed with ovarian cancer in 2012. Over 70% will die. That means ovarian cancer will kill almost 16,000 women this year. 1 in 71 women, perhaps your wife, mother, daughter, sister, grandmother, aunt, or friend, will develop the disease in her lifetime. Can you imagine the impact? My name is Sean Rupp, and I can, because my mother, Susan Marie Rupp, was one of ovarian cancer's victims 2 years ago. My mother courageously battled ovarian cancer for 8 years of her life, not once, but twice. After defying all medical odds and reaching the 5-year remission mark, her cancer returned. The severity of this vengeful recurrence was completely overwhelming. Susan Marie Rupp was a lifelong resident of Pine Hill, New Jersey, and was devoted to her hometown, especially its children. She was affectionately known to most kids as Coach Sue or Mrs. Rupp. She was actively involved in the Pine Hill Youth Association as a coach for an unparalleled 39 years, and was a beloved teacher's assistant at the Dr. Albert N. Bean Elementary School for over 12 years. Although Mom faced every day of her life with her trademark smile and the faith, hope, and determination that she would win her tremendous battle, the truth is, statistically, she never stood a chance against her advanced stage 4 disease. Sadly, my mother lost her fight with ovarian cancer on July 30th, 2010, at the age of 52. Due in part to the overall lack of public awareness, no unified recognition month between states and the federal government, and no early detection tests, less than 20% of ovarian cancer patients are diagnosed early enough when the disease is most treatable, early enough when it matters. More must be done in New Jersey to identify this deadly disease in its earliest stages. Can you imagine your impact? Today, you have the opportunity to help promote ovarian cancer awareness to all New Jersey women by supporting Assembly Bill number 2161 to revise the state's designation of Ovarian Cancer Awareness Month to September. You can empower women and families by increasing their understanding and awareness of ovarian cancer, which is the deadliest of all gynecologic cancers. Today, you no longer have to imagine your impact. You can create your impact. For years, ovarian cancer was said to be a silent killer because its symptoms are subtle, common, difficult to diagnose, or often misdiagnosed because they mimic other less threatening problems. However, there are 4 textbook symptoms that do exist, and they increase in severity over time. These symptoms are not silent. They are simply whispering, and we need to make sure that New Jersey women are listening. The symptoms include bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, urinary symptoms such as changes in urgency or frequency. I ask you to support Assembly Bill number 2161 to turn these whispers into a united call for help, or even better, a yell, from the mountaintops of Northwest Jersey to the shores of Southern Jersey, by taking action today to mark September as Ovarian Cancer Awareness Month for our state. You would be joining President Barack Obama, who again proclaimed this September as National Ovarian Cancer Awareness Month, to honor those women we have lost, to show our support for women who bravely carry on the fight, and to take action to lessen the tragic toll that ovarian cancer takes on families across our nation. The tragedy it leaves in its wake reverberates in communities across our country. The small town of Pine Hill, New Jersey, has been missing a very special woman for 2 years now. This month, the month of September, I stand with all of those families and organizations who have known the pain of ovarian cancer, and we rededicate ourselves to the pursuit of new and better ways to prevent, detect, and treat this devastating disease. And it all starts with awareness. Will you stand with me? The Susan Marie Rupp Foundation was founded as a 501c3 nonprofit organization in September 2010 with its inaugural Teal Ribbons of Hope campaign. The foundation welcomed over 150 volunteers who handed out symptom awareness cards and placed over 1,000 teal ribbons, which is the nationally recognized color for ovarian cancer, throughout the streets of Pine Hill. However, despite its overwhelming success, the campaign did not happen exactly as planned. A closely guarded secret that has stayed within our family, it was my mom's idea to tie teal ribbons throughout her hometown to spread ovarian cancer awareness to those that she cared about the most, her friends, co-workers, and community. She picked the month of September due to its national recognition. Sadly, she was taken before she had the opportunity to accomplish her plan. What began as a private grieving process for our family to uphold my mom's plan in the month after her passing led to the Teal Ribbons of Hope campaign and formation of the Susan Marie Rupp Foundation. This September, our foundation reached new heights for ovarian cancer awareness by spreading our message of hope to 30 New Jersey towns in various counties. Nearly 300 volunteers proudly tied over 4,000 ribbons, teal ribbons, throughout the state. We even tealed some of your towns. For example, in District 4, Clementon, Gloucester Township, and Laurel Springs. In District 5, Harrison and Magnolia. And in District 6, Berlin Township, Gibbsboro, Hynella, Somerdale, and Stratford. By supporting Assembly Bill number 2161 to adopt September as the state's Ovarian Cancer Awareness Month and following the national lead, you will be fostering a partnership with other states, municipalities, companies, healthcare providers, organizations, and initiatives. While I wish there was a bill that existed to name every month Ovarian Cancer Awareness Month, we need to deliver a unified message across the state and country in the 30 days of September that can get the attention of New Jersey's women before it is too late. Since there is no early screening test for ovarian cancer, keep in mind a Pap test does not detect the disease. It simply tests for cervical cancer. It is imperative that all people recognize the signs and symptoms of ovarian cancer together in the month of September. Early detection saves lives. Can you imagine the impact we could have together? While there are numerous foundations promoting ovarian cancer awareness, and many large ones with the backing of big corporate sponsors, the Susan Marie Rupp Foundation vows to continue its mission to spread the message of awareness first and foremost in every tiny New Jersey town for that small town girl, just like Susan, who could be your wife, mother, daughter, sister, grandmother, aunt, or friend. Our foundation has great hopes and big dreams that our efforts in some way will one day contribute to finding a cure for this dreaded disease or saving the life of your loved one. My mom would like that. Dream big and believe in it. Let us start with adopting September as the month. We may be the underdog now, and that is fine, because we know that we have a champion on our side, our angel. Thank you.
Sean, your mother would be extremely proud of you. You are very articulate and very passionate, and I think we would all stand with you and be there for you. I think we're all motivated. I have driven through my towns and have seen the teal ribbons, and we see your mother and we see any other significant loss that any other family has felt of every woman that has died from ovarian cancer when we see those ribbons, and it does continue to motivate us. So thank you for what you do. And are there any questions from any of the assembly? Any other comments? No? Thank you very much, Sean, and thank you, Councilwoman, and thank you, Mr. Rupp. We really appreciate you coming and the spreading of the awareness. Take a vote? Yes. Do we have a motion? Okay, thank you.
Motion to release the bill as introduced in the committee. Assemblywoman DeCroce not here. Assemblywoman Casagrande? Yes. Assemblyman Wemley? Yes. Assemblyman Scher? Yes. Assemblywoman Mascara? Yes. Assemblyman Fuentes?
Yes.
And Assemblywoman Lampett?
Yes.
The bill is released.
Thank you very much.